Good morning and welcome to Ask Your Academic. Today's session will cover the MSc Precision Medicine with specialisms, and we're joined by Carolyn Loveridge, who's going to answer all the questions you have about the programme, hopefully give you a bit more information. We are recording today's session, so if you miss anything, don't worry. We'll send out to you in the next few days that you can watch it back and pick up anything that you missed. A number of questions have been submitted before today, so we'll do our best to get through all of those. But if you do have any additional questions, please just use the chat box and we'll keep an eye on that as well. If you've got any questions that are around sort of funding, accommodation, things out with the programme, I'm going to pop some helpful links into the chat box for you. And we've also got a University of Glasgow online postgraduate event coming up on the 7th of May. So that'll be a really good place if you do have any questions about sort of funding and that to pick those up there if you've not already got your answers from the links that I'll post. So I think we'll kick off with just introductions. So Carolyn, if you could introduce yourself and maybe give us a bit about the programme.
Yes, of course. Hi, good morning. Really nice to speak to you today. Thanks, Naomi, for setting this up. It's really nice to meet you. My name is Dr. Carolyn Loveridge. I'm a lecturer in the College of Medicine, Vet Medicine and Life Sciences in the graduate school there, and I'm one of the directors of the MSc Precision Medicine programme. So I do have a slide. So I think to start off with, I will just give you an overview of the programme. I'm sure this is really keen. I'm sure this is what you're really keen to find out a little bit more about. Hopefully you can all see the screen now, and I'll try and just talk you through this. So the MSc Precision Medicine with Specialisms programme is a one-year taught MSc programme. You will have the opportunity to opt for one of three specialisms, and these correspond with the three main areas where precision medicine is applied. So we have cardiovascular disease, cancer, and immunology. And for the specialisms, there are requirements for you to complete certain taught courses. So as I've said, this is a one-year master's that takes place over 3 semesters. So in semesters 1 and 2, you will undertake taught courses, so a total of 120 credits of taught courses. And then in the last part of the master's involves your research project, which is 60 credits. So it's 180 credits in total, 120 credits of taught courses, and then your 60 credit research project. So the core courses, just to go through this, so we do have core courses which all students will undertake. So in semester 1, we have precision diagnostics and therapeutics. So in this course, as the title sort of says, you will be learning about aspects of diagnostics and therapeutics linked to precision medicine. So we cover things like diagnostic imaging in different contexts. We cover the use of AI and machine learning. We have topics such as health economics. We cover things like the use of human tissues in research and the legislation involved in that. So that just gives you a wee flavour. We also have guest speakers from industry. So I think we've got somebody from Causeway Therapeutics that talks a bit about precision therapy. Then we have research skills in precision medicine. So that is a laboratory-based skills course where you will learn the techniques of qRT-PCR and Western blotting and some cell culture. So basically, this lab course involves treating cells with a reagent and then doing some qPCR and Western blot to analyse the effects of this agent. Across the 2 semesters 1 and 2, we have the World Changers Precision Medicine Seminar Series. So here we have a range of speakers from the triple helix of precision medicine. So that's that refers to links between the NHS, industry and academia. So we have speakers from all these sectors, and really quite well-renowned speakers. So, for example, for the course that's just run this year, we had Professor Dame Anna Dominicek, who's the Chief Scientist for Scotland, was one of the speakers, and we have CEOs of companies and clinical scientists from the NHS, to give you examples there. In semester 2, you can see here that there is quite a focus on omics here. So the first 2 courses here essentially involve training using R programming. So we've got omics data analysis and visualization in the first course, and then in the second course it's centered more around sort of clinical data, omics signatures and workflows there. So these are 2 very practical courses in terms of how to actually conduct these omics analyses and experiments. Then we have 2 pharmacogenomics courses. So we've got fundamentals and applied pharmacogenomics. So here you'll be learning about how genetics can play a role in terms of the effects of drugs and the key considerations that we need to think about when trying to determine what drugs we'll give to patients in terms of their genetics. So some patients might not be able to be given particular drugs because they have certain genetic changes. So these are really important considerations, or it might be that certain drugs will interact with each other depending on a person's genetics. So there you'll learn about some sort of basic molecular genetics and a little bit of basic pharmacology there as well. Okay. So for the specialisms, as I've said, we've got the 3 specialisms here, and students need to take the 2 courses that are listed for their specialism. So for cardiovascular disease, in semester 1, students will undertake the clinical aspects of cardiovascular disease, patients and populations course. And in semester 2, they do basic science of cardiovascular disease, tissues, cells, and signalling. So the first course is a bit more looking at cardiovascular disease at the population level, whereas the second course is more about the molecular aspects of cardiovascular disease. For the cancer specialism, students will undertake hallmarks of cancer. So in the first semester, so there you'll learn about sort of basic cancer biology, what the key hallmarks of cancer are. And that really brings everybody to the same level in terms of the basic knowledge and understanding. And then in the second semester, you will do cancer microenvironment and biomarkers. So there you'll learn about the different components of the cancer microenvironment, and particularly the immunology aspects of the cancer microenvironment. So, and treatment. So we'll talk about immune checkpoint inhibitors, for example, things like CAR T cells, cancer vaccines, what basically the effects of T cells and other innate immune cells in the cancer microenvironment. For immunology, we have principles of immunology. So there you'll learn about just basic immunology, the sort of cells and components of the immune system. For inflammatory diseases, in the second semester, you'll learn about various diseases such as rheumatoid arthritis, inflammatory bowel disease, asthma. So basically, that's providing the disease context to what you've learned from the first course. Okay, so the first course there is sort of the basics, and it's in semester 2 where you'll get the applied, where you'll be able to apply your knowledge to the context of inflammatory disease. But you need the foundations in that first semester course to be able to understand the processes that are involved in inflammatory disease. For the projects, these there is a requirement that these are in the area of the chosen specialism, and we do offer the opportunity of external projects. So in industry, so we do have various companies that offer projects. So a few examples there: Bioascent, Reprocel, Ubiquigent. So we've got various companies and also NHS projects. So for example, in the past we've had students go to the Glasgow Tissue Research Facility, and we've also got NHS Forth Valley, some projects there this year. So yeah, we do have the opportunity of that. Those places are limited. So we do also have a range of academic projects as well, that students will have the choice of. So I hope that gives you a good overview of the programme. And yeah, as I say, I think I've mentioned there the key things about the specialisms, what the core courses are, and the projects. So the projects are 12 weeks in duration, and they usually take place from mid-May to early August, just to give you an idea of timescales there. So I think that's probably enough of me talking for a minute. So I'm obviously very happy to answer any questions you have. So yeah, please feel free to either shout out your questions or post them to the chat. Happy to answer.
Thanks, Carolyn. Just on that research project, you kind of touched on it, but is it like in terms of choosing the topics, is it just a case of you sort of rank your top 3 or something and then it's picked that way? How does that work?
So we do provide students with a list of the projects that are available, and we ask that students rank their top 6 choices, and we usually are able to offer students one of their, well, we have been able to offer this year top 5 choices, but we do ask students to rank 6 choices, and yeah, so there is choice. It's not as though you're just going to be told this is the project you're doing. So there will be a list, and students will be able to rank their choices, and we do our best to obviously make sure that students get their top choices.
Perfect. And whereabouts do the classes typically take place? Are they normally main campus, or are they a bit all over the place?
So the classes usually take place on the main campus, so that's the Gilmer Hill campus. For those of you doing the cancer specialism, some of those classes do take place at the Garscoop campus, so there would be travel required there to go to the Garscoop campus, but for cardiovascular and immunology, all the classes are on the main campus, and the core courses are all on the main campus. Your project, depending on where you are, so obviously an external project, you might be required to travel to the company if you're working in a company, or to the NHS site if you're doing an NHS project, or cancer projects, because the main cancer research centres are based at Garscoop, then there might be a requirement that you undertake your project at Garscoop campus. But otherwise, most projects will be on the main campus as well.
Perfect. And I know there's no such thing as a typical week, but how many hours or days should students maybe expect to be on campus?
So yeah, to answer that question, to give you a rough idea, so we've got there's a list here of the credits that are for each course. So for example, precision diagnostics and therapeutics is a 20 credit course. So the rule of thumb would be that for a 20 credit course, there are 20 hours of teaching for that course. And then there is the expectation of self-directed learning beyond that. So compared to undergraduate, there will be less classes than you've probably had in the past. So typically, for example, for precision diagnostics and therapeutics, there would be maybe 2 1-hour lectures a week for that. So basically, at master's level, the purpose of the lectures is to kind of give you key information, but there is quite an expectation of self-directed study beyond that. So the lecturers will give you the kind of key material, but you are then expected to then go and look at the reading list and do work beyond that in terms of preparing for your assessments for the course. So.
Perfect. And that kind of maybe leads into it. Is there anything that students could do to prepare for starting their MSc?
So I do have, hang on, I'll stop sharing a moment. I can stop sharing. I do have a list of some possible reading that you can do before starting the course. Let me see if that will actually work in terms of posting it to the chat. Yeah, there you are. So we don't really have a set textbook or set reading that we would ask that you do before starting the course. So these are just some examples of possible textbooks that you can begin to take a look at. But in general, our lectures and course material is based upon research articles in journals. So because that's the kind of cutting edge research. But certainly no harm in having a wee look at one or two of the textbooks that I've posted there to start to think about this area. I think the key thing before you start would be to think carefully about which specialism you want to do. And you can certainly obviously start to look into that particular specialist area. So cancer or cardiovascular disease. You can maybe just start taking a wee look into that particular specialist area. Yeah, I think that would be the key thing, but there's no set pre arrival work that we would ask that you do.
Perfect. I always remember someone saying that if you've been given an offer, there's clearly something in your education and background that you're capable of doing the programme.
Yes, exactly.
Yeah. And what do graduates go on to do after graduation?
So we have various jobs that our previous students have gone on to do. So some will stay in academia and continue their studies towards doing PhDs. So we do have quite a few students that have gone on to do that. We do have students that have gone to jobs in industry. So an example of a company there would be Charles River. We have students who've gone on to do medical writing. So an example of a company there would be McCann Medical. We have students who have gone on to become clinical scientists. So they've undertaken the training programme to become clinical scientists in the NHS. So yeah, and we've also had I think some students who've gone on to do research assistant sort of posts. So without going on to do a PhD, they've stayed in academia, but in a sort of research assistant or more technical capacity.
Good. That's quite a mix then. And the last question that I've got here, so if there is any other questions that you do have, please use the chat box there. But the last question was if you get any advice for new MSc students.
I think one of the key pieces of advice I would give you is that it is quite an intensive year of study. So it is important that you kind of bear that in mind. But I think the key thing is that we want you to enjoy yourselves while you're here. So you are going to get a great experience, we hope. We really would like you to come to Glasgow. Obviously, we want you to enjoy your time in Scotland. We want you to enjoy some sort of scope out with your studies as well as your actual study. So trying to find a balance is good between your study and your kind of external hobbies and things that you might want to do while you're here. So I think that would be my key piece of advice, because it is an intensive year. I won't lie there. You are going to have to work hard, but it is important that you, for your well-being, that you have a good balance, and there will be lots of opportunities for you to engage with to take up hobbies and different things that are going on. We also have the Graduate Skills Award. So there you can again build up your kind of transferable skills. You can get involved with things like some volunteering along the lines of sort of science communication, those sorts of things. So yeah, I think just bear in mind it's not just all about study. So yes, we want you to work hard and do well in your study, but there is a bigger picture, and we want you to have a good overall experience. So think about the other things that you can do that are going to really enhance, your sort of career prospects moving forward as well.
Yeah, I think, and once registration opens around August time, like if you don't already have an idea of how much stuff there is to get involved with, you definitely will, because just at your induction weeks and stuff, all the societies and all that, it's amazing the amount of stuff to get involved with. Um,
Exactly.
well, we don't. I think we've covered all the questions that we've been asked. I don't know if there's anything that you think we've missed or that you'd like to mention. I mean, you've mentioned a lot in a really short space of time, so I don't know if there's anything that you've missed.
I can't think of anything. I think I've kind of gone over the key information about the actual program. I've provided some potential reading. Yeah, just to restate that there are going to be lots of things you can get involved with. And yeah, just really looking forward to meeting you here in Glasgow. So yeah, really encourage you, if you haven't already actually applied, then please do obviously apply, and yeah, we'll look forward to seeing you in September, all being well.
Perfect. Well, I think that's a nice place to wrap up. Thanks very much for your time today, Carolyn, and thanks very
No
much
worries
for
at all.
all that have watched. And like Carolyn said, hopefully we welcome you all in September. So thanks very much for your time. Bye bye.
Okay, thank you very much. Thanks. Bye bye.